Hello and welcome to the Bazooka. This is a series on my YouTube channel where we'll look at 10 OSCE stations in one clinical course. Today we're going to be looking at Pediatrics. This is Season 2, Episode 3. My name is Dr. Moses Kazevu. If you haven't yet subscribed to the channel, please hit the subscribe button, hit the bell notification icon to be receiving notifications of such videos every time I post. Grab your piece of paper, grab your pen, and let's go. So beginning with our station 1, a 9-year-old patient is brought to Living Mwanawasa University Teaching Hospital with a history of vomiting, weight loss, and passing a lot of urine for 2 weeks. On examination, he is lethargic with dry mucous membranes. RBS is 28 millimoles. Weight is 20 kilograms. What other questions would you like to ask the mother? What is the possible diagnosis? What investigations will you do? What are the possible complications of your diagnosis? And you already know the drill. You may pause the video at this time if you so wish before I give you the answer. And here comes the answer. So I feel like we've done this question before. So this is a history of a diabetic child, and obviously, you're going to be asking for a history of diabetes in the child. You're going to be asking of a history of diabetes in the family. You're going to be asking for a history of fever or any upper respiratory tract symptoms, any chest pains, any cough. You're also going to be asking for the last meal this child ate, and any history of any medication that this child is taking. Ask for the HIV status of this child, and ask if they have had any history of a similar illness. How I like to take this history approach or question approach based questioning type of system is like I like to envision myself as the doctor that's actually seeing this child. What questions will I ask this child if they came in presenting with such and such complaints? Then the possible diagnosis obviously would be a type 1 diabetes mellitus. This child could possibly be in diabetic ketoacidosis. What investigations will you do? So you do a full blood count or a complete blood count with a differential count, a urinalysis. You also do your urea and electrolytes as well as creatinine. You also order for an oral glucose tolerance test. What are the possible complications? They may be short-term complications, things like diabetic ketoacidosis, hypoglycemia that is often due to insulin treatment, or you could have long-term complications that could be microvascular complications such as diabetic retinopathy, diabetic nephropathy, and diabetic neuropathies. Moving on to the next station, station 2, describe what you see, write down your diagnosis, name 2 etiologies of this condition, name 2 commonly associated abnormalities in the congenital form of this condition. Again, you may pause the video if you so wish. And if you still haven't yet subscribed, what are you waiting for? We are, at the time of this recording, 80 people till we reach 1,000 subscribers. So please keep sharing the videos, keep sharing the link to the page until we reach 1,000 subscribers. And when we do reach 1,000 subscribers, I will do something special for the channel. So here comes the answer. So as we can see, there are sunset eyes over here. There's also a prominent forehead. This is obviously hydrocephalus. So name 2 etiologies of this condition. So they may be congenital, which is often due to aqueduct stenosis. You may also have Dandy Walker malformation, where you have a malformation or hypoplastic cerebellar vermis. You also have Arnold-Chiari type 2 malformations. You may also have acquired causes such as meningitis or post-intraventricular hemorrhage. Then name 2 commonly associated abnormalities in the congenital form of this condition. It is often associated with spina bifida or lumbosacral myelomeningocele, and it also may be associated with Chiari malformations, which is obviously downward displacement of cerebellum as well as the medulla through the foramen magnum into the cervical spine. Moving on to question 3. Or station 3, describe what you see on this picture. What is the diagnosis? Write down 3 systemic birth defects associated with this condition. Give 2 risk factors for this condition. Mention 2 screening tests you would carry out at birth. Again, you still may pause the video and scream at your screen if you so wish, or write down your answers, whatever you want to do. But here comes the answer. So as we can see here, there are epicanthal folds. There is a flat nasal bridge, a round facial profile, upslanting palpebral fissure, though not so prominent in this case, as well as a macroglossia over here. So what is your diagnosis? This looks like a child that has Down syndrome and 3 congenital systemic birth defects. They may have congenital heart disease, duodenal atresias, imperforate anus, umbilical hernias, cryptorchidism, which are undescended testes, and hypospadias, where the opening of the urethra is on the shaft of the penis, either on the ventral side or the dorsum. Then give 2 risk factors of this condition: increasing maternal age, as well as a history of having a child that has Down syndrome. You may also have, if the parents are genetic carriers of a stable translocation. Then mention 2 screening tests that you would do. You do a hearing test as well as a thyroid function test. They also need visual examinations, often time to time. Station 4. This is a 6-year-old child who presented with a fever and skin lesions. The following day, the fingers appeared gangrenous and he lapses into shock. Question 1. How do you describe these skin lesions? What is your diagnosis? What is the causative organism? Give 3 essential investigations towards the diagnosis. So I shall zoom this picture, and if the quality of your video is low, please turn up the quality on your settings so that you can actually visualize these lesions, because most of the time students are going to have in the complaint that they can't really see the images. So I will zoom them for you over here. Rule of thumb is that if you can't really see it, even though it's not so clear, you're obviously not going to see it when it becomes clear, and you won't know the answer. Because if you don't know, the brain cannot really regurgitate, or rather say what it doesn't know. So I think that's enough of viewing the image, and here comes the answer. So these are erythematous maculopapular rash, or you can actually see that some of these are petechiae. So obviously the diagnosis here would be meningococcemia, and possibly this child could be in a complication that's known as Waterhouse-Friderichsen syndrome, which is a very serious complication of meningococcemia, where a child can present you with features of shock, adrenal hemorrhages, and of course these characteristic lesions that you see on the skin. The causative agent is Neisseria meningitidis, and 3 important investigations that you may want to order: a full blood count with a differential count that may show you an increase in the neutrophil count, and you may also do a blood cultures in order to isolate the Neisseria meningitidis. You may also order for a coagulation panel, because DIC is one of the complications that may be associated with this. Station 5. This is a 2-hour-old neonate born by SVD. List down 2 potential problems you would examine this neonate for as a result of this mode of delivery. Name 3 complications related to this neonate's condition. What would you want to know about the mother to help with the diagnosis? So I will give you 2 seconds to think through this question. If you are liking these videos and you want more of such contents, please drop a like and drop a comment in the comment section below on what you would want to see more on the channel. If you want to see these OSCE stations, or if you want to actually do see these MK's Secrets videos where I answer essay questions on the channel, or if you have any idea of what you would want to improve on the channel, drop it in the comment section below, because we are a channel that listens to the people and we are for the people. And here comes the answer. So this is a child obviously that has fetal macrosomia. As you can see, this child is quite huge for a baby that's just been born. So complications that may be associated with vaginal delivery include obstetric brachial plexus injuries, birth fractures of the humerus, of the clavicle, even subluxation or dislocation of the hip. 3 complications associated with the neonate in this condition: hypoglycemia, so you want to check your blood sugar when this child is born and feed this child as early as possible. They could have metabolic syndrome, where they have a constellation of features such as hypertension, hyperglycemia, and even increased cholesterol. You may have talipes calcanovalgus. You may also have metatarsus adductus. Then what would you want to know about the mother to help with the diagnosis? You want to ask if there's a history of the mother having diabetes. You also want to ask if there's a history of the mother having a child previously that had fetal macrosomia, or generally if there is familial macrosomia, generally if they're born with huge babies. Then station 6, what is this equipment called? What are the indications? What are the sites? They're supposed to be sites, not sits. Sites where you do the procedure from. Take your time, pause the video. I know you may not have seen this on the words. If you have, then you are indeed lucky and you will be able to answer this station over here. If you haven't, then I will give you the answer in the next slide. So here comes the answer. This is obviously a bone marrow aspiration needle. It's used for diagnostic collection of samples from the bone marrow in diseases like leukemias, even in bone marrow failures. Then the sites where we collect these bone marrow aspirates are from include the sternum as well as the iliac crest. Of course, it is a quite painful procedure to do. Then station 7, a 10-year-old presents to the hospital with generalized body swelling, anasaka, and an elevated temperature of 38 degrees. Preliminary investigations are done, a full blood count is taken, and shows hemoglobin of 8 grams per deciliter, white blood cell of 8 times 10 to the power of 9, neutrophils of 30%, lymphocytes of 20%, platelets of 33, and a red cell distribution width of 26. A blood slide is collected and the results are shown in the image. What abnormalities are present from the full blood count? What does the blood slide show? What is the full diagnosis? What other investigations would you undertake? So take your time to pause the video, look at the slide, look at the hemogram, and answer the questions below. I will give you 2 seconds. And here comes the answer. So this child over here has a low HB. HB of 8 is low. They have a low platelet count. This is low. They have increase in neutropenia, a decrease in neutrophils, as well as an increase in red cell distribution width. So what is shown on the slides here, of course, ring forms that you can see here, or trophozoites. These are often seen in Plasmodium falciparum, and this child indeed has severe malaria. Most possibly has acute kidney injury because of the presence of the generalized body swelling, and the child also has anemia, though it's not really severe, and the child has thrombocytopenia. Then what other investigations would you undertake? Liver function test, because the thrombocytopenia, the anasaka, the generalized edema, may be as a result of liver issues, or just to check the functioning of the liver. You would also want to do a coagulation panel because these platelets are very low, so this child is at risk of having spontaneous hemorrhages, is at risk of having disseminated intravascular coagulation. Also serum glucose, because hypoglycemia is a complication of severe malaria. Urea, electrolytes, and creatinine to check the functioning of the kidneys. Station 8. Shown is a picture of a child that presented to the emergency department with respiratory distress and stridor. Describe the abnormalities shown in the picture. What is the diagnosis? What is the causative organism? What is the type of inflammation caused by this organism? List 3 complications. Again, take your time, pause the video. You can scream at your screen right now. And here comes the answer. So this is a bone neck that is shown in this image on the right. This is a bone neck and a pseudomembrane that is seen in the posterior oropharynx. So the diagnosis here is obviously diphtheria, which is caused by Corynebacteria diphtheriae. Then the type of inflammation is acute pseudomembranous inflammation, and 3 complications include things like cranial nerve palsies, respiratory failure, myocarditis, and renal tubular necrosis. Station 9. A patient presents with history of fever, headache, and neck pain. Histology is shown in the picture. What is the diagnosis? What is the causative organism? How would you treat? So take your time to pause the video and you may write down your answers now. If you do get them correct, please hit the subscribe button. If you already have hit the subscribe button and you're getting these answers correct, then hit the like button and drop a comment below. It will help the channel and it will help with the YouTube algorithm. So here comes the answer. This is obviously bacterial meningitis. The triad of fever, headache, neck stiffness, or neck pain is going to be leading you towards meningitis. And if you look at these seem rather round and clustered. So this could be that most likely it's a Neisseria meningitis. Then how would you treat? So you admit the patient. If you check their blood glucose. If there is hypoglycemia, you treat hypoglycemia, of course, with intravenous dextrose. You treat the infection with intravenous antibiotics, broad spectrum. You could use cephalosporins such as cefotaxime or penicillin such as crystalline penicillin, monitor their vitals, administer any antipyretics like intravenous paracetamol, give IV fluids, of course 2/3 of the fluid requirements to prevent syndrome of inappropriate ADH secretion, treat any seizures that are going to be present with diazepam. Then the last and final station, study the image and answer the questions that follow. What is the equipment called? How is the patient supposed to use it? So here's the image on the right. Study it and answer the questions below. I'm pretty sure you should be familiar with this image if you are, or you know someone who has ever used it, or you have been on a pediatric ward or even in a medical ward. So you may pause the video now. So here comes the last and final answer. So this is a spacer and this is an inhaler. So this is an inhaler and this is a spacer. You can actually disconnect this. So how you're supposed to use it. So you tell the patient to shake the inhaler well before you use it, about 3 to 4 times. Remove the cap from the inhaler and from the spacer. And then if it has one, then place the inhaler into the spacer. Then you're going to be breathing away from the spacer, then breathe out away from the spacer, then bring the spacer towards the mouth. Then of course you're going to be pressing the top of the inhaler once, and you breathe in very slowly until you have taken one full breath. Then you hold your breath for at least 10 minutes, then breathe out. So that's how we use a spacer and an inhaler. If you enjoy these videos, why not thank me by hitting the subscribe button and hitting the like button too, sharing the page and sharing the link to this video such that it may help someone who's preparing for exams. We will be releasing such more content during the course of the week, so please stay tuned to Zambia and beyond. My name is Dr. Moses Kazemi.